Assalamualaikum and hello everyone. My name is Haziq Izuddin Bin Adzhar. I'm from RSR2433B. So today I would like to talk on topic the importance of first aid. Incident and injury can happen at any time and anywhere, day or night, at home, at workplace or public area. However, do you have a knowledge about first aid? First aid is vital during an emergency where it can save someone's life. Let me let me share with you about incident that happened to me during 2016. At that time, I was 16 years old. The incident was happened on 1 o'clock in the morning. At that time, my father was not feeling well and he went to the toilet. And I was studying at my room at that time. And then I went to the kitchen. Suddenly, I heard boom. Something hit ground so hard. And the sound is from the toilet. And then I opened the toilet door and I saw my father was on the ground, which is fall on the toilet, fall in the toilet. And then I didn't panic, but I don't know what to do. I was blank. And the first thing that, and also the only thing that I do at that time, I just slapped my father's cheek like that. Fathers, can you hear me? And there is no response. He was unconscious. So I going upstairs and call my mom. And after that, we go back to the toilet. And at that time, my father was conscious. So he was unconscious about 6 minutes without any first aid was performed. So on the next day, we go to the hospital and my father was admitted in the hospital. And my father's doctor said to me, your father was lucky because he was survived even there is no first aid was performed because his heartbeat was stopped about 6 minutes. So at that time, I was thinking that it's time for me to learn about first aid. So now, look at the pie chart. According to the article from the National Library of Medicine's studied about national population-based survey on the prevalence of first aid, cardiopulmonary resuscitation, and automated external defibrillator skill in Singapore. As you can see, there is 23.6% of Singapore households do not have knowledge about the first aid. Not only that, a study carried out by St. John's Ambulance confirmed that there are 140,000 people die annually where first aid could have saved their life. Today, at the end of my speech, I hope my audience will learn about the knowledge of first aid because it can save life-threatening incident and injury. Now, let me explain what is first aid, the aims of first aid, and the barrier of applying first aid. First aid is an emergency measure generally consisting of simple, often life-saving techniques that most people can train and perform with minimal equipment and no previous medical experience. The term usually refers to administering care to a human, although it also can be performed on animal. Next, we go to the aims of first aid. First, to preserve life, where saving life is the main aim of first aid. Second, to prevent further harm. Person who has experienced injury must be kept stable and the condition must not worsen until the medical team arrive. And the last one is to promote recovery, which may include applying bandage to the wound. However, What is the barrier for people not applying first aid? Because, as I mentioned before, people with no previous medical experience also can perform it. Now, look at this chart. As you can see, common barrier to applying life-saving skill were lack of knowledge 36%, fear of doing harm 22.1%, and lack of confidence 15.3%. Now, we have known the major barrier to applying first aid is lack of knowledge. The solution is Dr. ABC. What is Dr. ABC? Dr. ABC or First Aid Primary Survey is basic first aid knowledge that apply in every emergency situation. During emergency situation, we will follow this Dr. ABC procedure. D stand for danger. Check for dangers to the injured person and yourself. If there is danger, can it be cleared? Or can the individual be moved away from further harm? If there is nothing you can do, stand clear and call professional for help. R. R stands for response. Once it is clear that all danger has ceased, check if the patient is conscious and alert. Ask questions and see if you get a response. It is also important to find out whether they respond to your touch and aware of their pain. Then A stand for airway. Check whether the airway is clear, and if not, try to clear it by gently tilt the head back while slightly raising the chin upwards. Then use your fingers to clear obstruction that present. Next, B stand for breathing. Examine the chest for movement and the mouth for sign of breathing. Afterward, get close to the person to see if air can be felt on the cheek from breathing. And the last one is C, circulation. If the person involved in emergency situation is not breathing, the first aider should go for chest compression or known as CPR and rescue breathing. The chest compressions will promote circulation. With knowledge of the first aid primary survey, we can get the benefit. Let's see what is the benefit you will get. There are 3 benefits. First, lessens the severity of an emergency in a given time and place. When applied first aid, we can reduce the degree of injury. Second, we can make the difference between life and death. A study carried as I mentioned earlier, a study carried out by St. John's Ambulance confirmed 140,000 people have died annually, where first aid could have saved their life. And the last one is to reduce recovery time. We can reduce the recovery time from month to week or day only by applying first aid. In conclusion, first aid is very important for us. Let's bring awareness to our society that we can save someone's life by learning basic first aid. It's better that we can do something when someone is needed than just being a witness of someone suffer. Thank you.